Okay, so this morning we're going to have a chat about fatty liver. What's it all about? Okay. If you need a reference for this, there is an NHS website that has all about fatty liver. We'll come on to what we call it in a wee minute. But first of all, we're going to take a step back and we're going to chat a little bit about the liver. Okay. Presumably most people have heard of the liver. It's an essential organ. It sits on the right-hand side of the abdomen, and it's the largest internal organ. It's weighs usually about 3 pounds on average, and it's the size of a football. All right, so it's a huge organ, and I'm just going to share a pic of it here. All right. So can you give me a wee nod if you can see that?
Yeah.
Yep. Okay, good. Right. So it's located in your abdomen, just under the diaphragm. It's a huge organ. It basically runs from one nipple to the other nipple. Okay, it goes right across from the right nipple all the way over to the left. It sits just in front of the stomach. So you've got your esophagus here, you've got your stomach, and then it goes in, you've got your small intestine and your large intestine, and you've got your little gallbladder poking out here. Your gallbladder releases what I like to call the fairy liquid of the GI system, or the gastrointestinal system, to break up your fats. Okay, so this is a good healthy looking liver. There's two lobes. There's a right lobe, which is larger than the left lobe. And then this is a fatty liver. All right, which is the issue. And we're going to chat about that in a minute. So that's where your liver sits. That can actually be palpated. And by that, I mean, we can actually feel that. So an examination, you may be asked to lie down flat. And as a physician, I would often ask, I would put my hands on somebody's abdomen and ask them to take a big deep breath in, and that should push your liver edge down. Okay. I should only really be able to feel it though if it's inflamed or if it's enlarged. All right. It also can be more difficult to feel depending how much subcutaneous fat you have. All right. But it can be felt. And one of the tests to look at your liver would be an ultrasound scan. All right. But let's go back a little bit again. We're going to chat about the functions of the liver. Does anybody know what the liver does, or one of the things it does? It does loads of things. It's really, really important. Anybody give me an idea of what it does?
It filters some of the impurities out of your blood and things like that.
Yeah, so it's a big detox factory. Okay, so it does a lot of detoxification, and that can be of in things we just take on board, whether it be food items or whatever, or it also metabolizes medicines. So lots of the medications you take will go through the liver, hence why if you take a paracetamol overdose, you will damage your liver. You can put yourself into, you can go into liver failure. Okay, so it metabolizes lots of medications and it metabolizes lots of good things. Okay, anything else?
It's stored glycogen.
It does store glycogen. Excellent. So one of the big things that the liver does is it takes up glucose after we've eaten. And that glucose is converted into glycogen, which is the big carbohydrate storage molecule. And that's the liver is then a good source of glucose. So essentially at 3 o'clock in the morning, if you haven't eaten for 5 or 6 hours and you want to maintain your blood glucose at say 5 millimoles per liter to keep your brain happy and keep all your other organs happy, the glycogen will be broken down by the liver, and the liver is the big organ that releases glucose. The other organs that can convert glucose into glycogen, your muscles, but your muscles are greedy. They hold on to your glycogen, and your glucose, they do not release it. So it is your liver is the main organ that essentially keeps you alive at 4 o'clock in the morning when you haven't eaten for 4 or 5 hours, when you've fasted, and you need glucose to keep everything happy. Okay. It also is involved in fat and protein metabolism. Okay. Your liver is the big organ that is involved in making protein. All right. And it is also involved in the metabolism of your lipids. And the two main lipids we usually chat about, I do individual sessions on these, are cholesterol and triglycerides. Okay, and we'll come back to those later on. The other thing the liver is very important is blood clotting factors. Okay, so if you have a problem with your liver or liver disease, you can have a problem clotting. All right. And the other thing it does, I've already alluded to, I was chatting about the gallbladder, it makes bile. So bile, again, is bile acids are essentially the fairy liquid of the gut. Okay, so the bile is produced by the liver and it's stored in the gallbladder and then released into the gut as and when it is required. Okay, so those are some of the functions of the liver. So it's incredibly important. All right, big organ. Now, In terms of a healthy liver, it should contain little or no fat. All right. It's not a place that we should necessarily store fat. So where are the two places we can store fat in the body?
Under our skin.
Yep, so under our skin is, and that's called subcutaneous. So there's a layer of fat under our skin, and that varies from person to person. Some people can store more fat under their skin than others. And then the second place we store fat is called, it's visceral storage. And visceral just refers to an organ. So a viscera is a technical term for an organ. So your kidneys are a viscera, your heart's a viscera, your muscles are a viscera. So we store fat in other organs when we have excess fat, and the liver is a big site where excess fat storage can occur. Okay, so when I've said before, a healthy liver shouldn't contain very much fat at all, little or no fat. When your liver does become fatty, we have a term for that, and it's called non-alcoholic fatty liver disease. Now, the reason why it's termed non-alcoholic fatty liver disease is when you take a history from a patient, if they are a big drinker and consume quite a few units of alcohol a week, it's not non-alcoholic fatty liver disease. It's alcoholic fatty liver disease. And that's because the alcohol affects how the liver metabolizes fats, and the excess calories, et cetera, can be converted into fat. All right. So non-alcoholic fatty liver disease, which is called NAFLD, NAFLD, non-alcoholic fatty liver disease. Now, there's a new term that has come up, and the reason why I think this has come to light recently is because of the link between non-alcoholic fatty liver disease and metabolic dysfunction, which I'm going to go into in a minute. But just in case you come across this, if you're doing any additional reading, it's metabolic dysfunction associated steatotic liver disease. You can now see why I want to stick with the non-alcoholic fatty liver
Much
disease.
easier.
It is, and it means I can, even when I'm dictating letters, I can just say NAFLD and my secretary will know exactly what I'm talking about. If I start spouting on about metabolic dysfunction associated steatotic liver disease, her head will explode. But I presume that's the new terminology due to the fact that it's a fatty liver is got a huge link with metabolic dysfunction in your body and metabolic syndrome, which you may have heard of. All right, so that's why it's abbreviated as MASLD, and Reg and I were chatting last week, so it's kind of MASLD or something. I'm not even too sure. So at the moment, I'm sticking with NAFLD because I can say NAFLD. MASLD, not so much. But just in case you come across that. Now, NAFLD, or non-alcoholic fatty liver disease, it's estimated that 1 in 3 people in the UK have it. And I would imagine that's probably correct. 1 in 3 have the early stages of non-alcoholic fatty liver disease, small amount of fat in the liver, because it's quite easy to lay down fat in your liver if you're overweight. Okay. Now, the good news is at the early stages, it does not really cause any harm. The bad news is when you've had a fatty liver for a long time and the disease progresses, you get more serious damage. Okay, and it can end up with something called cirrhosis. Now, you've probably heard of liver cirrhosis, but normally associated with alcoholic fatty liver disease. And practicing in the west of Scotland, we have a huge problem with alcoholic liver disease, ALD. All right, and lots of our patients will have cirrhosis, which is end-stage renal or kidney failure. So, having a high level of fat in the liver is associated with other diseases, which is why it's obviously got this new name involving metabolic. It's associated with diabetes, type 2 diabetes. And indeed, there's a kind of idea that the fatty liver disease preempts your type 2 diabetes by about 10 or 15 years. So you get your fatty liver, that then results in insulin resistance, and then you get your diabetes, your type 2 diabetes. All right, so there's a real association between fatty liver and type 2 diabetes. High blood pressure is also associated with fatty liver and also kidney disease. And I think the idea is if you have a fatty liver, you won't just have a fatty liver, you will have other fatty viscera. And by that, you'll probably have fatty kidneys. We also know that type 2 diabetics, as the disease progresses, will also have a fatty pancreas. All right, and the pancreas is the organ that releases your insulin. All right. if you already have diabetes and non-alcoholic fatty liver disease, you've got an increased risk of developing heart disease. We know there's a close association between fatty liver, diabetes, and heart disease. And again, I do a session on type 2 and type 1 diabetes, so we'll cover that at some stage. Now, that all sounds a bit grim, especially because it can proceed to cirrhosis. Nearly said psoriasis there, completely different issue. Cirrhosis, all right. The good news is, though, if detected early enough, it's reversible. It's like your type 2 diabetes. You can do something about this, okay? And you can decrease the amount of fat in your liver. Okay, so we're going to chat now about the 4 main stages of non-alcoholic fatty liver disease. So the first stage is essentially just simple fatty liver, and that's called steatosis. S-T-E-A-T-O-S-I-S. I just call it fatty liver. I never say to my patients they've got steatosis, okay? Because I don't think it's really self-explanatory. I think simple fatty liver is a lot more straightforward. So that's kind of what we would deem a harmless buildup of fat, as in it's not affecting you from a metabolic point of view at this stage. However, I would argue it's the beginning of that, and if we were aware of that, we could do something about it. So how is simple fatty liver diagnosed? And this may be diagnosed basically on a set of routine liver function tests, which are just simple blood tests. So when you get your liver function done by your GP or a hospital physician, you will get an array of blood tests in the panel. Usually get your bilirubin, and that's usually goes up if you have a blockage somewhere, and the bilirubin's the issue you have if you've got jaundice. Your bilirubin is high. That's what makes you go your skin go yellow, or your eyes, your sclera go yellow. Okay. You'll also have an albumin, which is just a level of protein, and your liver's involved in making albumin. But the 2 main things that you want to look at in terms of fatty liver disease are the enzymes ALT and AST. And essentially, those enzymes are in your liver doing liver things. When your liver is inflamed, which happens with simple fatty liver disease, those enzymes leak out into the blood, and they can be measured in the blood. All right, so that will be your kind of first idea that you've got simple fatty liver disease, because you won't have any other symptoms from fatty liver disease the first stage. You won't feel it, you won't know at all that you've got it. And it may be picked up just with simple routine liver function tests. And that's where I pick it up. I pick it up all the time in my lipid cardiovascular risk clinic. And that is because lots of the patients I review have got problems with their cholesterol and their triglycerides. And the reason why they have problems with cholesterol and triglycerides is because they are overweight and have got fat around their liver. And then we do their liver function tests, and we can see that their liver function tests are deranged. Okay. Now, the second stage is called non-alcohol steatohepatitis, NASH. And this is more inflammation, and it's more serious. And we think about 5% of the UK population are in this stage. All right. Again, this stage is still reversible, okay, if you change certain things, which we'll come on to later on. You can go back into stage 1 and then remove the, get down to not having a fatty liver. The third stage is getting a wee bit more serious. This is fibrosis, and that's persistent inflammation. And when something becomes fibrotic, so if you cut yourself and you get a scar, that's fibrosis, that's the process. The liver will still be functioning normally, pretty much, because it's a big organ. It's got lots of reserve, so it'll still be doing all the things. It'll still be making protein. It'll still be storing glucose as glycogen, etc., etc. And dealing with any medications you take. It'll still be doing all that, so it still functions normally. But you're now getting to process the stage 3 fibrosis, where you've done damage, and once it's fibrotic and scar tissue, that part of the liver cannot rejuvenate itself. Okay, so you're doing some damage now. And then the fourth stage is cirrhosis. And to begin with, when you've got your second stage and your third stage, this is where you've got persistent inflammation and your liver becomes enlarged. And this is where sometimes we can palpate as a physician, we can actually feel the liver age and say, yeah, you've got an enlarged liver. When you get to stage 4 cirrhosis, your liver has actually shrunk. Okay, and the damage is now permanent. And cirrhosis often leads on to liver failure, and there's an increased risk of liver cancer. So that's another issue with that. Now, again, this takes years to develop. This does not happen in 3 or 4 months. All right, it takes years and years to develop. but it's just the different stages of non-alcoholic fatty liver disease. Anybody get any questions about that?
If you have a scan done, will you see it on a scan as well?
Yeah, so what we did, and previously, my early stages of working in the clinic, we would get an ultrasound scan done. I still get them done occasionally. I don't get them done on everybody now, because I know if you've got an elevated body mass index, and we'll come back to that, because it's not, you don't have to have an elevated body mass index to have a fatty liver, because we've got toffee, we've got thin in the outside, fat in the inside. So we have people who are slim looking, but they actually can have a fatty liver. But that's not very common. We also have people who are overweight and have a elevated body mass index and an elevated waist circumference, and they might not have a fatty liver. All right, but those are the extremes at either end. In general, if you're overweight, the chances are you've got it, and you've got weight around your abdomen, particularly, you've got a fatty liver. And we used to send them all the time to get scans done. COVID then happened, and now getting a scan done for something serious, if you're querying cancer, can take a while now. So we don't send as many people for scans. But if you do get an ultrasound scan of your abdomen, yes, it will basically tell you that you've got fatty infiltration on the scan. So it's just a simple ultrasound scan. It's not a very technical test. It's just using an ultrasound where they use the jelly and they'll scan over your liver, and they'll be able to tell you, people get them done to see if there's gallstones and things like that. But yeah, it'll be able to tell you if you've got a fatty liver or not. But we don't routinely, we don't do an ultrasound scan. People lose weight, do X, Y, and Z, change their lifestyle. Side of the bag, you can do it with changing lifestyle, but I guess you all knew that. It's not, we don't rescan to show you that you've lost fat. Okay, it's not that, you know, we don't do serial scans or anything like that, essentially because the NHS just can't do that. But you could get a scan. Yeah.
Yeah, I had a scan. Yeah,
Right.
I had a scan, and they said everything, all my organs were fine. So
Good.
I assume that's good.
It is good, yeah, it is. Right. So so who's at risk of NAFLD? People who have obesity or overweight, especially if you have truncal fat. So again, I've said many a time on my masterminds, don't care if you have a bum the size of Florida. I really don't. It's the truncal weight around your abdomen, okay? Because that's the metabolic, the fat under your skin, the subcutaneous, is not metabolically active. It's quite inert. Nobody really cares about that. But it's the visceral fat. It's the fat around your liver is really important because it is metabolically important. So apple-shaped versus pear. Who's at risk? People with type 2 diabetes. The chances are you've had a fatty liver, because that all plays into the insulin resistance, which has resulted in your type 2 diabetes. High blood pressure. Again, people with weight around their abdomen and overweight more likely to have high blood pressure. High cholesterol. There's a tie-in with non-alcoholic fatty liver disease. The high cholesterol is basically just indicating that your liver's not coping, because your cholesterol, 20% is from the diet, 80% is from what your liver does, because it's the big organ that metabolizes your cholesterol and your triglycerides. And again, it all ties in with this thing called metabolic syndrome. And metabolic syndrome is often diagnosed in people who are type 2 diabetics or insulin resistance, overweight with truncal obesity, high blood pressure, and then problems with their lipids, in particular high triglycerides and low HDL. Don't panic about triglycerides and HDL. I do a whole session on those, okay? We'll come back to that. More common in people over the age of 50 years, again, because it's something that's built up over 10 or 15 or 20 years, but can happen, and we are seeing it in younger people. Why are we seeing it in younger people? Because we're seeing younger people who are more overweight now, and that's all got to do with the diet, you know, the foods that we eat, etc., and we'll come back to that. So we are diagnosing it with younger people, and I see a lot of people now between the age of 25, 30 and 50, as opposed to being over 50. But previously it was people over 50, because it takes a while to build up. All right. It's been diagnosed in younger people without any risk factors. Again, medicine's often an art, not a science. And I've said before, you can have fatty liver. I had a patient in 2 or 3 weeks ago, and he said himself, he said, I'm slim, but I've got issues on the inside. And I said, yeah, you are. And he already realized that. Now, whether he read up on it or not, I'm not too sure. So you can be thin on the outside, fat on the inside. Apparently, I was listening to something recently, Mike Mosley. Everybody remember Mike Mosley? Okay, he was the same. He did his metabolic stuff and was really surprised, because he was never overweight, tall guy, slim, but he was thin on the outside, fat on the inside. Apparently he had issues. All right. Importantly, it's not due to alcohol intake. Now, there will be people who, again, have a fatty liver and drink, but don't maybe drink excessively. Again, in clinic, I would suggest, I always say to people, well, one of the things you need to cut your calories down. So alcohol is one of the things, but the alcohol will not be helping your liver. Okay, but there should be a differentiation between non-alcoholic fatty liver disease and alcoholic fatty liver disease. Okay, so back to symptoms. So symptoms are something that you will go and tell your doctor about, something you're feeling or noticed wrong, and there aren't any in the early stages. None, zero, nada. As I said, it can be discovered due to deranged liver function tests. And the two I talked about was the ALT and the AST. Those are two liver enzymes that leak out into the blood when your liver's inflamed. ALT is alanine transaminase and AST is aspartate transaminase. The names don't really matter. They're just enzymes that are involved in the liver and they leak out into the blood. And also your ultrasound scan, which we've already chatted about. Now, you do get symptoms when your liver disease progresses. By the time, but it's really quite late. By the time you get cirrhosis stage 4 of the liver disease, that's when you become jaundiced. You'll get itchy skin, swelling in your legs and abdomen, something called ascites. And that's all got to do with the fact that blood can't travel through your liver anymore or as much anymore, and your liver clears a huge amount of blood. It's got a big portal vein that takes a huge amount of blood through it all the time. And because your liver's so small, there's congestion, et cetera, and you have problems with fluid. But that's really, really end stage, okay? So there's not really much that goes on before then. And as I said, normally if you're diagnosed with fatty liver disease, it might be just because you're getting routine liver function tests done for whatever reason. And again, we do liver function tests on all our diabetic patients, type 1 and type 2 annually. All right, so that's something we do in clinic. So diagnosis is liver function tests plus or minus an ultrasound scan. Now, if you are diagnosed with fatty liver disease, you can get further staging. Now, this is not something I do at this stage. I refer my patients to gastroenterology. Further blood tests are required, and then there's kind of a fibro scan. I don't know if anybody's heard of anything like that, but if you've had a problem with your liver, the gastroenterologist will do a fibro scan, which is another fancier type of ultrasound scan, plus or minus biopsy. And the fancy fibro scan basically is a specialized ultrasound machine for the liver, which measures your fibrosis or scarring, and you get a score for that. And the gastroenterologist can basically, it's a FIB4 score, they call it. So they will be able to tell you how fatty your liver is and what stage you're at, okay, in terms of fibrosis going into cirrhosis, etc., etc. Okay, but that's kind of out with my remit. That's a kind of specialist test, and either your GP or someone else will determine whether you need to go forward for that or not.
I've had a Caroline.
Sorry, say that again, Jane.
I've had a fibro scan.
Okay.
And it was because they were looking for people to be in a study, and so they, I got a free fibro scan. But
okay, there you go. Excellent.
Non-alcoholic fatty disease.
That's his track, isn't it?
Yeah, it's still over the curtains again.
In the end, I didn't have a high level of whatever the score was, and so they wouldn't let me on the study. And it turned out that my non-alcoholic fatty liver disease is virtually gone now.
Excellent.
Yes.
So that's another. So I think Alex on Monday, if I can remember rightly, he's always asking about. So it's like non-scale wins. So that's a non-scale win, Jane.
Absolutely.
And that's massive as far as I'm concerned. Massive.
Diabetes has gone as well.
Brilliant.
Your diabetes.
Well done.
See, there you go, knocking it out of the park. And those are all. We all get hung up. I've just been before I came on this morning, I was listening to another podcast, and it's one of the PTs I follow, and he was explaining. I remember when I started TSD, so I started in January 21, I think, and Tristan was my coach at the time. Okay, he was a coach at the time, not just doing the stuff he does, the weights and stuff. He was actually my coach. I think it was the middle of COVID, so he had quite a few clients. Anyway, I think after so many weeks, I'd sent him a photograph of someone who I wanted to look like, kind of thing. And bless him, he never really replied, skirted around the subject. And then I found out, it must have been about 6 or 9 months later after doing all the reading. And I'd never really read about, I'd never done weights before I started TSD. So the poor bloke started me off with standing squats. I literally he got me sitting in a chair and got me to stand up. And of course, next thing I got quite obsessed with my body shape and what I looked like. And I hadn't really been like that before. But I found out really quickly, it was I think I asked him about, why am I not doing crunches? And he said, well, you sit hunched over a desk all day at work, don't you? And he said, why would I ask you to do crunches? So he was doing loads of exercises with me for my core, but there wasn't a crunch or a sit up in sight, not one. And he said, that's all nonsense. And it's all the stuff you see in social media, you know, do these and you'll have abs and stuff. I do have abs, you just can't see them because there's a little layer of fat over them. But the guys that you can see their abs, there's a really small percentage of the population you can see their abs. And that's usually genetically predetermined. The other people that you can see their abs, they can hardly lift a pen or walk up a flight of stairs when you can see them because they've reduced their body fat by so much, etc., etc. So through TSD, the evolution for me has been, yes, everybody's got an ideal body shape and what they want to look at. But far more importantly is decreasing your fatty liver, reversing the fatty liver and not being diabetic anymore. That in terms of your health far outweighs what you look like. Because we all are different shapes and sizes. That's just the way it is. And quite a bit of that's genetically determined just because.
Caroline, that was one of my main reasons. It's Helen, why I joined TSD, because I get regular blood tests and they said, oh, look like you've got fatty liver. And I'm like, oh, and I thought, I don't want this. So it was one of my big whys. And yes, 2.5 stone later, they did a FibroScan when it finally came through and it wasn't there anymore. So, yeah.
Brilliant.
Yeah. So
Yeah.
that's huge, massive. And in terms of the fact that your fatty liver and your type 2 diabetes all eat into cardio, you know, or all increase your risk of cardiovascular disease, strokes, heart attacks, etc., etc. You know, you're reducing the risk of all of those things, and that's massive, massive. And coming off medications, you know, that's massive as well. I'm just doing it through lifestyle, which brings me nicely on to the next thing. So what are we going to do? And you guys will know this because you just told me, 2 of you have just told me you don't have fatty livers anymore. So what do you do to stop it getting worse? Now, there's no specific medication, all right? And I think that's possibly one of the reasons why we don't talk about metabolic syndrome per se anymore. And we don't talk about fatty liver as much because there isn't a drug that we can give people to reverse it, all right? Now, I am sure people are probably working on that. However, there isn't one. So if there's no medication, what are we going to do?
We're going to lose weight.
We're going to lose weight. But even stepping back from that, what are we going to do?
Be more active, get off our backsides.
Yep, nicely said. Nicely done. Nicely put. So
have a look at our diet and the types of things that we're eating, I guess.
Yeah, so we're going to make healthy lifestyle choices, which is essentially what TSD is all about, isn't it? It's changing your lifestyle. It's not a diet, it's changing your lifestyle. So we're going to change nutrition and we're going to change activity. I guess those are the 2 things. However, there's an umbrella around that, isn't there? So essentially, healthy lifestyle choices. We want to lose weight, okay? But you know, that's not as simple as it looks. There's lots, you know, it's not just, yeah, let's just lose weight and off you go. Or you don't say to somebody, let's just lose weight and off you go. So we want to lose weight. Losing 10% or just over 10% can remove some of the fat from your liver. And again, I do a session when we chat about your weight and things like that. And I show you the calculation to work out how much percentage body weight you've lost. In terms of nutrition, there's what we do in TSD, but can anybody tell me what type of foods we should be eating and why, or what foods we shouldn't be eating and why? Okay, you can do it either way.
Whole foods and vegetables, lean meat.
Yeah, so many, many years ago, when heart disease went through the roof, everybody started eating a low-fat diet, but a high carbohydrate diet. That all happened in the 70s and 80s. We were aware of heart disease, people being overweight, etc. This is when the whole epidemic started. And the message was low fat, high carbohydrate. Now, we kind of messed up slightly there, not on purpose, okay? We didn't do it on purpose. We just didn't know better, any better, I'm going to say. So what happened is people went for low fat. Now, we do want low saturated fat, okay? Because there's different types of fats. And again, I chat about this when we chat about triglycerides. So low saturated fat. So that's where the lean meat comes into. Yep, eat meat, that's fine. Meat's got protein in it, but should be lean. Now, if you're in TSD, the chances are you're eating lean meat. Why eating lean meat? Because you're watching how many calories you're eating. And if you're watching how many calories you're eating, you're not going for the fatty cuts of meat, because you can have your fatty cut of meat if you want, but you don't eat for the rest of the day. Doesn't satiate me at all. Okay, so I was very much at the beginning of my TSD journey, I wanted more bang from a buck with everything. Okay, I wanted to eat. If you went through with me, the laugh, Deborah Hunter went through with me, and a couple of the others went through with me, and the laugh, I was always whinging about cheese. Now, I didn't eat a ton of cheese beforehand, but the first time I cut 20 grams of cheddar, I looked at it and went, oh, for the love of God, a mouse wouldn't even be happy with that. So I don't eat cheese anymore, because it doesn't, I can fill myself up with cheese, but if I fill myself up with cheese, I'm going to have eaten 500 or 600 calories of it. 20 grams was about 80 or 100 calories, and I just thought that's just not worth it. So I just don't. So we want to be careful with saturated fats, but there are unsaturated fats that are good for our health, come from nuts and avocado. Again, they're good heart health fats, but they're high in calories. Avocados are highly calorific, and so are nuts. So you can have it, but just not oodles of it. What happened in the 70s or 80s, we went to high carb diets. Now, in essence, you can have carbs, but it depends on the type of carb. So the carbs we want, as Jane has said, fruit and veg. Okay, so eat the rainbow is a very simple message that Alex used to go on about a lot when I started TSD. If you're eating the rainbow, you should have a high fruit and veg intake. The problem lies in you can't have a high refined carbohydrate intake, because refined carbohydrates, once you replace your glucose in your liver and your muscles, and it gets converted into glycogen, and your muscles and your livers are full of glucose, the excess glucose from refined carbohydrate just gets converted to fat. And that's how you produce your fatty liver. So refined carbohydrates are a no-no. And I will see lots of patients who come in with a fatty liver, they've got a fatty liver, and this results in really high triglycerides. And the first thing we do is have a chat about nutrition and diet and the intake of refined carbohydrate. And that's usually in the form of full fat drinks and crisps, cakes, etc., or lots of like white bread, white rice. Okay. So those are the things we have to be careful. And again, from TSD, you'll know that you may have rice, but you'll not have an absolute bucket load of it. You should have more veg on your plate to fill you up. Okay. So a healthy, balanced diet's required. Low saturated fat, high carbohydrate, but not refined carb, or not high carbohydrate, but carbohydrates, but not refined. We need carbohydrates. What do we need carbohydrates for?
Energy.
Yeah, because glucose is basically used in every cell in our body, bar none, for energy. So that's why we need a carbohydrate, but it has to be the right type of carbohydrate. Okay, so exercise is important. Now, for a fatty liver, we want to lose weight. Okay, because the whole idea is if we lose weight, eventually the fat will leave our viscera, our liver, and it will be less fatty, and then you can move yourself out of the fatty liver range. Exercise is important. All types of exercise can improve non-alcoholic fatty liver disease, even without weight loss. Okay, so the exercise helps control glucose and also blood pressure. So if you're thinking about it, if you exercise, move more, and you can call it exercise, you can call it activity. Exercise is a very loaded topic or word to use, because everybody thinks of going to the gym for whatever reason, but just moving more will help your liver, because your body will use more glucose, and then there's less glucose convert into fat and be laid down. Okay. Smoking is also important, basically because if you've got a fatty liver, you've got an increased risk of heart disease and stroke, etc. So smoking's not good. The non-alcoholic liver disease isn't caused by alcohol per se, because you're probably not drinking enough, but it's not helping it, I would suggest. All right, I think if we're honest with ourselves. So the alcohol will have an effect. And if my liver function test went off the range and I had a fatty liver, I would probably abstain from alcohol just until I got myself back into, I'm not saying I would abstain forever, but I'm just saying I would probably abstain just to reduce the calories and just give my liver a bit of a break, because if it's really struggling, because it's really fatty. Can it be reversed? Yes, it can. And you've obviously heard that. Jane's obviously alluded to that. So the liver has an amazing ability to repair itself. It's a cracking organ. To do it, you really need to avoid alcohol, lose weight. So you can, the first two parts of it, the simple fatty liver and the inflammation, can be reversed. Once you go onto the fibrotic stage, you will be left with some fibrosis. And then obviously if you're in the cirrhotic stage, that's when you get to the stage where it's not reversible. Something to bear in mind, dieting, rapid weight loss can make it worse in the early stages, but we don't advocate, or TSD doesn't advocate rapid weight loss. In terms of diet, it's kind of the Mediterranean one. Now, the Mediterranean diet is probably one of the most diets studied, which is why there's so much literature on it. But it kind of makes sense. It's high fruit and veg and in good fats. And by good fats, I mean the unsaturated, your nuts and your avocados and things like that, and fish oils, etc., etc. All right. However, on saying that, if you overeat the Mediterranean diet, if you take too many calories in, you will still have excess carbohydrate and excess fats, and they will be stored as fat. All right. So, although to be fair, I don't think anybody's going to get into trouble eating a load of green veg. All right. So that's the kind of thing that's not going to cause any problems. Okay. Has anybody got any questions regarding that? So basically, to summarize, non-alcoholic fatty liver disease, NAFLD, affects a huge amount of people in the population, including in the UK. Okay. And most of it will be undiagnosed. If it gets picked up, it's usually due to a random set of liver function tests, plus or minus an ultrasound scan, if you're lucky enough to get one of those. And the treatment of it, there's no medication, which I think's a good thing. And it's lifestyle. Okay. It's all about moving more and eating the good stuff. Does that sound fair enough?
I've got a question. I did miss the first 20 minutes, so I was having difficulty finding where it was to log in. I've had itchy skin, and I know I've had ascites from a scan from a heart problem. Should I be worried about it? Because as far as I know, my LFTs and ASTs are okay.
I can't give any individual health advice. I'm not. This is purely an educational session. Okay.
Oh, yeah, no,
so yeah, you'll have to get that addressed by your GP.
So
there are lots of different reasons for itchy skin. Okay. So there's lots of different causes. So apologies, no, I can't guide you with that. And my advice would just be simply to go and see your GP and get that reviewed. And they can do a full history and a full examination and then determine if there are any issues. But your itchy skin is usually the final stages. So there would be lots of other things going on. But yeah, no, you should speak to your GP about that.
Thank you. I think it's worthwhile going to them. So thank you. And I do realize the position you're in, so don't worry.
Yeah. No, it's just one of those things. I can't get indemnity for. Well, I couldn't give clinical advice. That would be crazy.
Yeah, no, I understand. Don't worry.
Okay. Anybody else get any other questions? No. Anybody not? And no question is a stupid question. Everybody understand everything about fatty liver disease?
Could I ask you a question?
Yep, sure.
What happens if you haven't got a gallbladder like I have? Does that put increased pressure on your liver? A lot of people don't have gallbladders nowadays.
Yeah, no, lots of people
don't.
No, I don't know. No, I don't think so. It's something we can obviously, it's nice to have one, but if you can't have one for whatever reason, if it got blocked before there was an issue, yeah, no, gallbladders are taken out all the time. I think the only thing you would realize as a medical student, I was always remembering telling, or well, I didn't tell patients, but the consultants would tell the patient at the time, you may have found this yourself. If you eat a very fat loaded meal, so for example, the one that always springs to mind for me is fish and chips,
Yeah.
you may struggle, you may have a bit of abdominal discomfort, and that's essentially because you will still produce bile from your liver, but you don't have that little pouch of bile sitting in your
Yeah, it's in the
gallbladder.
stomach, isn't it? Yeah.
Yeah. So you might have issues digesting very fatty foods, a big fatty meal. But again, at this present moment in time, that shouldn't be an issue. I can't see you eating very high fat meals at the moment on TSD. So yep, no, the gallbladder removal's been going on for many years, and there are no issues per se. As I said, it's just eating a fatty meal might be a little bit more difficult, but then we wouldn't advocate that anyway, so that's okay.
Thank you.
Anything else, or is everybody happy enough with non-alcoholic fatty liver disease?
Yeah.
Thank you.
Oh, okay,
Thank you
right.
very
So
much.
I can't remember what I'm doing next week. Give me 2 seconds and I'll be able to look that up for everybody. I'm sure we must be getting let's see what we're doing next week. Health consequences of obesity. All right, so that's kind of a resume. I must be getting to the end of my sessions, which means I'm going to start cardiovascular disease again. So I've come across another couple of pictures recently, which are quite good. But yeah, so we'll be doing health consequences. So that'll kind of cover the whole lot. It's kind of a resume next week. All right, so that'll be next Wednesday. Okay, well, look, I hope everybody has a lovely week.
Thank you.
I'll catch up with you then. Okay, have a good day.
Thank you.
Bye.
Bye. Bye, everyone. Bye.
Bye.